My name is Jennifer Arnice, and I represent the Department of Health and Human Services, Early Childhood Services. Tonight's event promises to be very informative. This evening will be a bilingual presentation with myself and others interpreting along the way, so I ask for patience as we translate into Spanish. Please note that this session is being recorded, and due to the size, all participants are muted. Buenas noches, me gustaría dar la bienvenida a todos. Mi nombre es Jennifer Arnaiz y soy parte del Departamento de Salud y Servicios Humanos. El evento de esta noche promete ser informativo. Esta noche será una presentación bilingüe con yo y otros interpretando. Aviso que esta sesión se está grabando. También por razón de la cantidad de gente, todos los micrófonos están apagados. We appreciate everyone who took the time to submit questions on the registration that helped develop this evening's agenda. We have invited special guests to help inform your practice and decision-making as you continue to operate or reopen your childcare program during this pandemic. Agradecemos a todos los que se tomaron el tiempo para enviar preguntas que ayudarán a desarrollar la agenda de esta noche. Hemos invitado presentadores especiales para que les ayuden a informar sus prácticas y tomar decisiones mientras operan o reabren su programa de cuidado infantil durante esta pandemia. This evening's agenda includes an introduction by our County Executive, Mark Albridge, a presentation by Dr. Travis Gales, Montgomery County Health Officer and Chief Public Health Services, and Caroline Sturgis, Assistant Chief Administrative Officer. Unfortunately, Stephen Hicks, Assistant State Superintendent from Maryland State Department of Education, had a last-minute conflict and is unable to join us this evening. I will convey their message and answer some of your questions. Once all our speakers have presented, we will open for viewer questions submitted through the registration process, and if time allows, through the question and answer box, which I'll explain in a minute. Nuestra agenda de hoy incluye una introducción con nuestro objetivo del condado de subdirectora administrativa. Desafortunadamente, Stephen Hicks, asistente del superintendente del Estado, Departamento de Educación del Estado de Maryland, tuvo un conflicto de último minuto y no pudo unirse con nosotros. Compartiré su mensaje y responderé algunas de sus preguntas. Una vez que todos hayan presentado, abriremos para contestar preguntas enviadas y, si el tiempo les permite, a través del casillo de preguntas. As a courtesy to all and appreciation that it is Monday night and for many a workday, we will end promptly at 7. Como cortesía para todos y entendemos que sea un lunes por la noche y muchos un día de trabajo, terminaremos puntualmente a las 7 p.m. I would like to now welcome our County Executive, Mark Albridge, who will kick us off tonight. Ahora quisiera dar la bienvenida al Ejecutivo del Condado, Mark Albridge, quien nos iniciará esta noche.
So first thing I want to say is I'm really glad to have this opportunity to chat with all of you today. I know how important early childhood education is, and I really am glad we're having this discussion.
Okay, thank you. Buenas noches y es un placer estar con ustedes hoy y me alegro de dar la oportunidad de hablar sobre este tema que es muy importante para todos.
So I know that everybody has concerns about reopening and where we go from here, and I understand how incredibly difficult COVID-19 has been for the childcare community.
Most of you todos estén preocupados con lo que quiere decir reabrir y que especialmente los centros de cuidado de niños que han tenido que cerrar.
And I understand the financial implications for your businesses, even as the counties try to open or reopen in a safe and responsible manner. The most important thing I have to do is keep people safe.
Entiendo que también ha sido un momento que económicamente ha sido muy difícil para todos los centros y mi responsabilidad es asegurarme que puedo mantener a todos saludables y poder hacerlo de una forma responsable.
And at the same time, I understand how critically important early early care is, because if we don't have early care programs available, our workforce is not going to be able to return to work.
También estoy consciente de lo importante que es el cuidado de los niños, porque realmente si no abrimos y no podemos abrir los centros de cuidado, mucha de nuestra gente no puede regresar al trabajo.
And I really especially want to thank the childcare providers who are able to provide spaces for the essential workers in Montgomery County. Again, without those spaces, our essential workers would not have been at work.
Quiero agradecer también a aquellos centros que pudieron abrir y pudieron cuidar a los niños, a los hijos, hijas de los lo que son los empleados esenciales. Sin esa ayuda, ellos no hubiesen podido trabajar durante este periodo.
So joining me tonight, Dr. Travis Gales, who's going to share specifics about health and safety concerns of childcare, and Caroline Sturgis, who's one of my assistant CAOs, is going to speak about the Relief Fund, and they're going to be on the panel with me today. And Joanne Barnes and Barbara Andrews are also going to be available to respond to questions. And of course, Jennifer Arnaiz is moderating in English and Spanish.
Junto conmigo hoy en el panel van a estar el Dr. Gales, que es el médico del condado realmente, para hablar sobre todos los temas de salud. También Caroline Sturgis, que es asistenta al administrador. Ella va a hablar sobre el fondo. Y también van a estar Joanne Barnes y Barbara Andrews para responder preguntas, y Jennifer, que está de moderadora y también intérprete.
But as many of you know, I'm a former school teacher. I taught elementary school in the county for 17 years.
Como muchos de ustedes saben, yo he sido maestro, enseñé 17 años en una escuela en 4º grado.
And I could see firsthand how critically important early childhood education was for children, and how much a difference it made for children who had it and for children who weren't able to get access to it.
Y reconozco muy bien, y lo vi en mi trabajo como maestro, lo importante que es la educación preescolar para los niños y la diferencia que hace el que vengan a la escuela con esa preparación.
And I know that if we're ever going to be able to close the opportunity gaps that exist, the difference between the background knowledge that some students bring to the classroom on day one versus other students, that the early childhood education is the key to closing those differences and putting everybody on a level playing field.
Y sabemos qué importante es que la educación preescolar cierre la brecha que existe entre grupos que tienen mayor acceso y menor acceso. Entonces, estoy muy claro de que es bien importante que podamos cerrar esa brecha y que todos los niños comiencen al mismo nivel.
So I want the children of Montgomery County to continue to be able to have access to high quality care and education, and also to ensure their parents that they can go back to work as businesses reopen. This is the task that's in front of us now.
La meta ante nosotros en este momento es que los niños puedan regresar a centros de educación preescolar que sean de alta calidad y que sus padres también puedan regresar a trabajar. Ese es el tema del momento.
And I want to thank and recognize our HHS staff, Joanne Barnes, Barbara Andrews, and Jennifer Arnaiz, for the support they've given to providers throughout these months. We've been able to continue training online. We've been able to continue to provide technical assistance for federal and state and local funds that were available. We've been able to provide supplemental funds for those who are serving essential employees. We've had 9 PPE distributions. And for people who don't know what PPE is, that's personal protective equipment. We've distributed supplies to an average of 350 centers and homes in each distribution.
Quiero también tomar un momento para agradecer a todo el personal del Departamento de Salud y Bienestar Social, que son Joanne Barnes y Jennifer Hannes y Barbara Andrews. Y quiero agradecerles especialmente porque pudieron proveer el entrenamiento necesario, la asistencia técnica a muchos de los centros para que puedan solicitar dinero federal, local y estatal. Además, hemos podido suplementar los pagos del Estado a las personas a los centros que pudieron proveer servicios a familias de trabajo esencial, y hemos podido distribuir, tener 9 distribuciones de todo lo que se relaciona a desinfectantes y materiales de limpieza a más de 350 centros.
And in this time, we've been able to distribute 1,500 gallons of bleach, 1,200 bottles of cleaner with bleach, 750 gallons of hand sanitizer, and 2,500 cloth masks. And we continue to build supplies in the county so that we can continue to provide support to the centers that need our help.
Bueno, hemos podido proveer más de 1,500 galones de bleach. Hemos podido repartir 2,500 máscaras y otros elementos de limpieza, y vamos a seguir haciendo todo lo posible por proveer esto para los centros y los hogares infantiles.
And if you remember, we have a partnership between the Council of Montgomery College, MCPS, and the executive branch under which we established the Early Childhood Initiative. And that initiative was well on its way to meeting our first year goals when the pandemic hit. And I'm looking forward to receiving the initiative's report and action agenda and to continue to move forward in our goal to extend the provision of childcare in the county.
Bueno, como se recordarán todos ustedes, hace un año yo comencé una iniciativa junto con el Consejo y con Montgomery College y con el Sistema de Educación Pública, en el cual iniciamos la iniciativa de educación preescolar. Esta iniciativa estaba terminando su reporte y concluyendo con su primer año, así que estoy ahora esperando el reporte que nos llegue de la iniciativa para poder empezar a implementar.
So while we're focused on this goal, I want you to know that I'm completely aware of how many of you had to close your doors and what the significant physical, financial impact has been on you and on your staff. And I just wanted to convey that I understand how difficult this period has been. That's why we're trying to make sure that we can do everything we can do to get you back to work, educating and caring for the youngest residents of our county.
Realmente entiendo lo difícil que ha sido este periodo, especialmente económicamente para todos los centros, así que queremos ayudar a poder ayudarles a todos ustedes a que puedan reabrir sus puertas y proveer los servicios a los niños.
And I want to thank the council for collaborating with myself and my staff on approving a $10 million child care relief fund. The application process will be open at the end of June. There's $6.5 million for child care centers and $3.5 million for family child care. We've simplified the application process so we can reduce the burden on applicants and reduce our processing time. And the intent is to assist in covering some of your losses and expenses associated with reopening and reconfiguring your centers.
Le agradezco al Consejo porque se acopló a mi iniciativa de proveer estos $10 millones para ayuda a los centros de preescolares. 6.5 millones serán para centros, 3.5 será para los hogares de cuidado de niños. Y vamos a asegurarnos de que la solicitud sea sencilla y no le aumente la carga a todos de ustedes en términos de poderla completar en la forma más fácil.
And finally, I've established the COVID recovery planning process. and I've directed the Childcare be represented on the Small Business Recovery Committee, as well as on other committees as appropriate. I've also asked the Early Childhood Steering Committee to serve as the Childcare Recovery Committee within HHS, and I understand this committee has had regular meetings with many of you to hear your concerns and receive your thoughts and recommendations as we move forward.
Bueno, quiero también avisar que he comenzado un proceso de recuperación para el condado. He pedido que todo lo que se relaciona a educación preescolar también esté representado en otros comités, incluyendo el comité de negocios pequeños. Y también estamos esperándonos, he pedido a la iniciativa que se encargue de ser el grupo que va a darme recomendaciones sobre la recuperación de los centros.
So I'll just say I'm going to be on the call for a while. I have to get off at some point to go to another call, but I want to listen to as much of this as I can. And despite the beautiful bay and the Golden Gate Bridge in the background, I'm actually in Rockville. But you know, it's good for all of us to fantasize a little bit, and I thought that was a good picture for tonight. But I do want to thank you and let you know how much I appreciate the work you're doing. And I look forward to continue to work with you as we reopen. And just again, remind you that I understand how critically important you are to our being able to reopen Montgomery County. So thank you.
Quiero agradecerles por estar aquí. Yo no voy a poderme quedar toda la sesión porque tengo otra reunión, pero voy a tratar de escuchar todo lo que pueda, y que a pesar de que la vista detrás de mí sea tan linda de una bahía y de un puente, estoy en Rockville, pero pensé que esta sería una buena imagen para este evento. Así que les agradezco mucho y voy a procurar escuchar todo el tiempo que pueda.
Thank you very much, Mark. Thank you very much for opening this up for us tonight. So now what I'd like to do is introduce Dr. Travis Gales. Dr. Gales, please share with our audience the current practices in light of the impact of COVID-19 in our community and how our county is responding. Ahora presentará al Dr. Travis Gales. El Dr. Travis Gales, por favor, comparte con nuestra audiencia las prácticas por razones del COVID-19 en nuestra comunidad y cómo está respondiendo nuestro condado. Dr. Gales. Oh, wait, he's on Netta.
All right, good evening, everyone. Very nice to be with you all, and thank you for the opportunity to speak with you all about where we stand with COVID-19 and some of the strategies that are specific to the pediatric population.
Bueno, quiero agradecerles. Buenas noches, yo soy Travis Gales y estoy aquí para hablarles hoy sobre las diferentes situaciones que comprometen a nuestros niños en relación al COVID-19.
I think it's important to first start with a conversation about what does COVID-19 look like. And for those who have experienced themselves or have family members, or for those who haven't, COVID-19 the symptoms include a host of different things. Everything from respiratory symptoms, cough, sneezing, shortness of breath, chest pain, also gastrointestinal symptoms. There's been reports of diarrhea associated with the illness, or the biggest presentation, which is actually most common in children, is having no symptoms at all.
Empecemos con entender qué son los síntomas y cómo se presenta el COVID, con tos, gripe, puede ser con estornudos, dolores de pecho, diarrea. Pero en los niños lo más probable es que no hayan síntomas.
And the big issue with children is the fact that in the very beginning we thought that children were perfectly fine, they wouldn't get sick, they would rebound perfectly. But we know that children can be impacted by it. In addition to having COVID-19, the fact that the majority of children often don't have symptoms means that they can unknowingly spread it to other family members who may fall into categories that are considered to be more vulnerable.
Bueno, y sabemos, al principio pensábamos que los niños realmente no iban a tener este COVID-19, pero nos hemos dado cuenta que sí, y el hecho de que no tienen síntomas es más peligroso porque ellos pueden contagiar a familiares o a otras personas alrededor de ellos.
And that underscores why it's important to make sure that we continue the same precautions that we put into place for adults in settings where children can be found. Additionally,
Por eso es bien importante asegurarnos que todas las precauciones que tomamos con los adultos deberíamos tomarlos con los niños.
and one last thing in terms of the pediatric population, recent data actually suggests that newer cases that are popping up within our communities are disproportionately impacting younger folk, even if the symptoms are less severe than we've experienced before.
Y en términos de los niños o la parte pediátrica de esto es que estamos dándonos cuenta ahora que los casos más recientes son casos que se están demostrando en los niños pequeños o en personas menores y que tenemos que tomar las mismas precauciones con ellos.
And so I just saw someone say, how young can children be impacted? We have seen cases as, I think, several months old in our jurisdiction to upwards over, I think our oldest patient was approximately 100 years old. So it can hit all age groups, and again, underscores why we have to be very careful. And in fact, there has been some reports that pregnant mothers have contracted COVID-19 from their younger children, which has put their pregnancy at risk.
Bueno, que también había una pregunta que decía que cómo sabemos que están afectando a los niños. Realmente, en realidad, los casos que hemos tenido en el condado son desde niños de menores de 6 meses hasta personas de 100 años. Así que estamos conscientes que esto puede ocurrir con los más pequeños también.
Now, for any of us who've worked with children or have children of our own, we understand the fact that children can be difficult to probably get on mask and keep them socially distanced. So it underscores the importance of putting in policies that will help emphasize those practices as much as possible.
Todos los que hemos estado con niños o cuidado niños o tenemos niños nuestros propios niños, sabemos que es bien difícil que los niños se pongan la mascarilla, es difícil que los niños mantengan distancia social y por eso tenemos que poner políticas bien claras para asegurarnos que estamos haciendo lo mejor en relación a nuestros niños.
So some of the strategies that are most important are, yes, we are asking children over the age of 2 to wear face coverings. We're also asking, where possible, to implement physical distancing between children to minimize their exposure and points of contact between one another. This can be achieved by putting in places to, again, keep them physically apart, but to also consider limiting the capacity of kids in a given setting at any given time.
Por eso mismo, bueno, sabemos que los reglamentos o las sugerencias son de que los niños mayores de 2 años usen la mascarilla y que también mantengan distancia social. Sabemos que eso es difícil, pero podemos poner políticas y reducir el espacio y el contacto que tengan los niños con otros grupos.
It's also important to make sure to have the kids wash their hands as frequently as possible, again, to avoid cross-contamination. It's also very important to make sure that there is a very aggressive, proactive cleaning regimen in place, cleaning any surfaces that kids may come into contact frequently.
Es bien importante que también nos aseguremos que se laven las manos todo el tiempo, de que tengamos políticas de limpieza consistentes y que limpiemos los espacios que tocan los niños con mayor frecuencia.
And some of the strategies put into place to minimize transmission from kid to kid are the same strategies that we put into place to protect illness on a regular basis. So very actively screening kids before they come in terms of if any of them are demonstrating any types of symptoms that are concerning, recommended that they stay home, and making sure to monitor and screen kids for any type of symptoms, including fever, respiratory issues, or things like that as they enter into the childcare facility.
Queremos, como con cualquier otra enfermedad contagiosa, queremos asegurarnos de reducir todas las posibilidades de transmisión. Y en parte eso es el el poder hacer el screening al principio, de tomar la temperatura, etcétera, y también monitorear todo lo que sean algunos de los síntomas de los cuales hemos hablado anteriormente.
And just a couple of last things to save time for questions. Folks have asked where you can get tested. You can get tested through your primary care provider if you have access to that end of it, to the healthcare system. If you do need other alternative sites, the county has multiple alternative sites through our vehicle admission station at White Oak, the Wheaton Rec Center, and the Germantown Up-County Regional Service Center, where individuals can be tested.
En términos de dónde podemos conseguir el test, el primer paso sería ir al proveedor de asistencia médica que utilice usted. Si no tiene proveedor de asistencia médica, hay un par de lugares en el condado donde se está ofreciendo el test gratis.
And if someone does test positive who has been in your facility, whether it's a staff member or a child, the county disease control staff will notify you and provide further guidance in terms of what you need to do to keep your facility safe, as well as notify any staff or children who are associated with your facility.
Bueno, si usted tiene algún caso positivo en su centro, adulto o niño, entonces va a recibir información por parte del el programa de salud para asegurar que usted sepa qué pasos tomar si hay un caso positivo en su centro.
Thank you. I will stop there for the rest of the presenters, but happy to answer any questions at the conclusion of the presentations.
Voy a parar ahí y puedo responder a las preguntas una vez que termine la próxima persona.
Thank you, Dr. Gales. So now I'd like to introduce our final presenter for this evening is Caroline Sturgis, Assistant Chief Administrative Officer, for the Office of County Executive. Me gustaría presentar a nuestra presentadora final de esta noche, Caroline Sturgis, Subdirectora Administrativa de la Oficina del Ejecutivo del Condado. Caroline? Oh, she's muted. There we go.
Be good. Thank you. You can hear me? Okay, great. Thanks everyone for your patience this evening. I would like to start off by saying good evening, everyone. And I'm delighted to be here tonight to provide an overview on the Early Care and Education Recovery Fund. The $10 million fund.
Buenas noches, yo quiero agradecerles por estar aquí y es un placer poderles informar acerca del Fondo de Recuperación.
The $10 million fund will provide grants to child care providers for reopening and recovery expenses.
Este fondo de $10 millones proveerá asistencia a los centros de cuidado de niños para poder reabrir o cubrir algunos de sus gastos para poder recuperar su negocio.
Okay. We recognize the childcare industry has been extremely challenged during the COVID crisis. Many childcare programs were forced to close and realized significant losses.
Reconocemos que todos los programas de cuidado infantil han realmente tenido un momento muy difícil en cuanto a lo de la crisis. Y en muchos casos han sido forzados a cerrar o reducir el número de niños que tienen, lo cual significa mucha pérdida.
As our county continues transitioning to reopening, childcare is an essential service required to support families as they return to work, and we need childcare open for business.
Necesitamos que todo lo que es el cuidado de niños esté listo para abrir, porque las familias tienen que regresar también a sus trabajos y vamos a hacer lo posible por hacerlo.
The $10 million fund includes $6.5 million for early childhood centers and $3.5 million for family child care providers.
El fondo de $10 millones será dividido a 6.5 millones para los centros y 3.5 millones para los hogares de cuidado de niños.
The fund will help the child care community recover losses experienced during the public health emergency and help these small businesses reopen.
El fondo será utilizado para recuperar algunas de las pérdidas y y asegurar bueno, que hayan perdido durante esta época de la crisis.
Okay. The maximum grant amount per provider is $75,000 for a single site, $150,000 for 2 sites, $200,000 for 3 sites, and up to a maximum of $250,000 for providers with 4 or more sites.
Bueno, la cantidad máxima que pueden recibir los centros será 75,000 en el caso de que tenga solo un centro, 150 si tiene 2, 150,000, 200,000 si tiene 3 y 250,000 si tiene 4 o más sitios de cuidado de niños.
The child care sites are eligible to receive the grant if they meet 3 conditions. It must be located in the county. They must be able to reopen by August 31st of 2020, and 60% of the children that they serve at each site must be Montgomery County residents.
Para ser elegible, hay 3 preguntas que se le van a hacer que son claves. El centro o el hogar deben estar situados en el condado, deben poder abrir para el 31 de agosto y siquiera 60% de los niños que participan son niños cuyas familias viven en Montgomery County.
And to be eligible for a grant under the Early Care and Education Recovery Program, applicants must have a licensed child care center, a registered family child care, or have a large family child care home or a letter of compliance program located in the county.
Además, para ser elegible debe tener su licencia o su registración o la carta de compliance para programas en el condado. Así que tiene que cumplir con una de esos reglamentos.
Applicants are also eligible if they're providing care for children from age 0 to 5 years old, and the business must also be in good standing with the state of Maryland.
Además, el centro o el hogar debe proveer servicios a niños de 0 a 5 años de edad y también estar al día con los requisitos del Estado.
Providers may apply to receive a grant to cover the amount of operating expenses or costs incurred to comply with COVID-19 health standards. Some of those include, okay.
Go ahead.
All right, costs incurred for COVID health standards include costs related to training staff on cleaning procedures and health and safety requirements, cleaning and disinfecting facilities, as well as personal protective equipment.
Los proveedores pueden, o los negocios pueden pedir el dinero para cubrir costos operativos, costos relacionados a el COVID-19, por ejemplo, todo el tema de limpieza y de procedimientos o necesidades que tenga o arreglos que tenga que hacer el centro en relación a mantener los reglamentos de limpieza. Y también si es que ha tenido pérdidas significantes, eso también es parte de lo que se puede proveer este dinero.
And finally, providers may apply for reimbursement of significant financial loss caused directly or indirectly by the COVID-19 during the months of April and May of this year.
Y las pérdidas serían durante el mes de abril y mayo de este año.
All right, so grant awards will be prioritized to programs who are serving low-income families and children with special needs.
Fuera de del tema de elegibilidad, también se va a dar prioridad a los centros que están ayudando a niños de ingresos bajos o niños que tengan necesidades especiales.
Or providing childcare in certain target zip codes with lower levels of childcare availability and higher concentrations of low-income families.
Incluyendo esos lugares de los códigos postales donde hay una mayor necesidad y mayor escasez de guarderías.
And we will also prioritize programs that are participating in Maryland's Excels program.
Además, se va a dar prioridad a los que estén participando en el programa de Excel.
Okay, we anticipate opening the application web portal next Monday, June 29th, 2020, and the application period will run for 3 weeks and ending on Friday, July 17th, 2020.
Anticipamos que vamos a abrir la página web para hacer la solicitud el 29 de junio. Vamos a dar 3 semanas para poder completar la solicitud, así que esperamos poder cerrar ¿cómo se llama? Poder cerrar la
aplicación.
julio 17.
The Department of Health and Human Services has worked with the Maryland Women's Business Center and nonprofit Montgomery. Both will be available to provide technical assistance before and during the application period.
El Departamento de Salud y Recursos Humanos también está trabajando con el Centro de Negocios de Maryland, de mujeres, Maryland Women's Center, y el nonprofit Montgomery para que ambos puedan dar asistencia técnica en el proceso de solicitud.
We will release the first orientation webinar tomorrow with additional information about this program. You may reference HHS website and social media for additional information.
Mañana avisaremos cuándo va a ser la primera sesión para poder darles mayor información sobre la solicitud y pueden chequear la página web de HHS también para la información acerca de cuándo vamos a dar la sesión acerca de llenar la solicitud.
Okay, this concludes my overview for tonight. I have shared a lot of information, so I will pause. Just want to thank everyone for attending today. Thanks for your patience as well as your dedication to our county and our children.
Gracias por participar. Yo sé que he dado mucha información, pero espero las preguntas.
Thank you, Caroline. So as I stated earlier, Stephen Hicks from MSDE was unable to attend this evening. He did have a message that he wanted to send, and I'll address that in a minute, and then we'll go straight into question and answer. I realized that the interpretation into Spanish is eating up more time than we had anticipated. So I'd like to propose to our panelists if we could extend about 10 more minutes so that we can get to some questions from our viewers. Como se dijo anteriormente, Stephen Hicks de MSDE no pudo asistir esta noche. Prestaré su mensaje y responderé algunas preguntas también. Como yo sé que la interpretación se ha extendido un poco el tiempo, quisiera dejarnos hablar unos 10 minutos más contestando las preguntas. MSDE states, nothing has changed since the announcement following the move to stage 2. Providers may contact their licensing specialist if they wish to reopen. The reopen verification form is located on the MSDE website. Capacity is now limited to 15 persons per room, but please note the increase is for 3s and 4s only, and full capacity at 15 for family childcare and large family childcare homes to include residents. All parents in Maryland are now eligible for childcare services. For questions, please see the frequently asked questions posted on our website. MSDE afirma, nada ha cambiado desde el anuncio posterior a transición a la fase 2. Los proveedores pueden comunicarse con sus especialistas si desean volver a abrir. El formulario de verificación de reapertura se encontrará en la página web de MSDE. La capacidad ahora está limitada a 15 personas por salón. Tenga en cuenta que este aumento es para niños de 3 a 4 años y la capacidad total en hogares de cuidado infantil incluye a 15 personas que viven ahí. Todos los padres en Maryland son elegibles para servicios de cuidado infantil. Para más preguntas, consulta, por favor, las páginas frecuentes publicadas en la página web de MSDE. So what I'd like to do now is to begin some questions and answers, the portion of the evening for questions and answers. And I remind you again to use the question and answer box on the side. I'm going to start with some of the ones that were submitted. So Dr. Gales, a question had come in, actually been brought up again today about the health directive of children wearing masks. Specifically, children over 2 are directed to wear masks during the day. So the question is the expectation that children in childcare also wear masks throughout the day, even though they are even though they are already following social distance guidelines by having smaller capacities in each classroom.
La pregunta es si es que nos pueda dar un poco de información el doctor acerca de si ya que estamos siguiendo todas las reglas de distancia social, si los niños de 2 años también tienen que usar sus máscaras.
So the short answer is yes. The guidance that we have on our county is consistent with the CDC recommendations that children over the age of 2 wear face coverings. And consistent with our approach in adults is that we would recommend as much as possible that the children wear the face coverings as much as they can to minimize any transmission from child to child.
La guía es clara de que dentro de todo lo posible los niños mayores de 2 años utilicen su máscara. Dentro de lo posible, esa es la guía.
Okay. Caroline, for programs that are located in public schools and cannot open until September 15th, will they be ineligible for the Child Relief Fund?
Para los programas que están en este momento situados en los edificios de las escuelas, que no pueden abrir hasta después del 15 de septiembre, ¿serán elegibles para este programa?
Yes, we will. Answer is no. We will allow a special provision for the programs that are in the child public schools. So they will be allowed a grace if they plan to open up in September.
Sabemos que hay varios centros que están en escuelas y sí vamos a dar vamos a asegurarnos de que esos centros también puedan solicitar.
Dr. Gales, I had a question regarding testing. Is there any special provision for childcare programs in terms of priority for testing if someone is determined to be positive?
¿Se está dando alguna prioridad a los centros de cuidado de niños para lo que es las pruebas del COVID?
So if someone tests positive, again, we would contact the facility and encourage folks to get tested as quickly as possible. And that would be through recommendations of your primary care provider or the network of options that I mentioned at the top of the program, including the alternative test sites that the county currently has. And we will be bringing more online in terms of pop-up testing and mobile testing opportunities.
Entonces, en el caso de que haya un caso positivo en uno de sus centros o hogares, nosotros le avisaríamos y le pediríamos que se hagan hacer el test, la prueba, y que la prueba, tanto empezando con su doctor de cama y de cabecera, y utilizando alguno de los recursos que tenemos, que nombré anteriormente, que tenemos en el condado. Y vamos a seguir montando más centros de pruebas. También vamos a tener centros móviles que estén por todo el condado.
So let me just add to that as well that under MSDE guidance, that any program that is in operation and has a positive test or a probable test is required to reach out to their licensing specialist and to our local public health department. So there's 2 calls that you have to make as a owner or director. Caroline, can you share a little bit more about the supports that will be associated with the relief fund? Perhaps what kinds of supports are going to be offered?
¿Qué ayudas? Esta es una pregunta para Caroline. ¿Qué tipo de ayudas y apoyo se va a dar para los que están solicitando para el fondo?
Okay, I believe the question as far as the supports for the relief fund mentioned earlier that there will be technical support available for those who need assistance with applying for the application. As far as the eligibility supports, what they can use the funds for, anything that's related to operating expenses, first of all, to open up the first month that they're going to open, which could be for salaries or payment of rent and other operating expenses. They are allowed to use the fund to reimburse costs incurred to comply with COVID-19 health standards, realizing that some programs may have to reconfigure their space to meet the smaller classroom sizes, training of their staff as they're returning back to work on, what are the cleaning procedures and health safety requirements that are necessary, cleaning and disinfecting the facilities as well as cleaning supplies, and if they need to incur any new material, toys and equipment as a result of the COVID-19 restrictions, those are costs that could be covered. Oh, I should pause for Bibi.
Ok, voy a tratar. Primero, sí vamos a tener ayuda y asistencia técnica para que puedan llenar las solicitudes. Esa información, cuando pongamos la información en el web sobre la solicitud, van a tener esa información donde recibir el apoyo. Y los gastos pueden ser para todos los gastos operativos, incluyendo salarios, alquiler, el costo relacionado a hacer reconfiguraciones de sus salones para llenar los requisitos, materiales que tenga que comprar para los niños, porque ahora van a estar separando grupos de niños, y cualquier entrenamiento que tengan que hacer para su personal en relación especialmente en relación al tema de salud y limpieza.
So let me just add to what Caroline said, because there was a question in the chat box about reconfiguring. If you read Maryland's reopening plan, they do talk about looking at reconfiguring rooms as a possible option. So in preparation for any changes that MSD may propose with that, we also want to be ready for that if those changes come during this period of the application.
Los reglamentos del Estado dan explicación sobre la reconfiguración de los salones, así que también queremos estar preparados con eso y ayudar con eso.
Okay, Dr. Gales, there's been talk about a resurgence of COVID-19 in the fall. How is the county preparing if a resurgence does appear?
Well, we are proactively taking steps to ensure that the measures that we've put into place are sustained, including enhanced testing, contact tracing, as well as our staffing models that we've been put into place to absorb the first wave, and hopefully the last wave, but the first wave of COVID-19.
La pregunta era acerca de que si vuelve a surgir el COVID-19, estamos preparados para eso en el otoño. ¿Qué preparaciones se están haciendo en relación a eso? Y lo que dice Dr. Gales es que estamos asegurando que toda la infraestructura que se está poniendo en lugar ahora en cuanto a las pruebas, en cuanto al seguimiento a las personas que prueban positivo, y el personal que necesita él en su oficina y en el condado, que todo eso esté preparado y listo por si haya otra
Recurrencia.
Otra ola del COVID-19 en el otoño.
And we are moving to make sure that we promote immunization and vaccines to our kids and the general public, particularly in the fall with flu upcoming. And we are, again, working to make sure that the strategies we have in place hold and are sustained.
Además, estamos asegurándonos que los padres de familia reciban información acerca de las vacunas y asegurarse de vacunar a sus niños, no solamente las vacunas regulares, pero también la vacuna del flu, porque realmente queremos ayudar a poder minimizar el que haya mayores riesgos en el otoño.
Let me just do a follow-up to that. I know that at the state level and locally, we've been looking at potential measles outbreaks because many children have not been receiving their immunizations. There will be a immunization clinic, I think is the correct word, scheduled for July 6th, and we'll be sending that out shortly by e-blast.
Yes.
El 6 de julio va a haber una clínica de vacunas, así que vamos a mandar eso a todos los emails que en la misma forma que recibieron la noticia sobre el día de hoy.
And I would add, from the state's perspective, there will be a push to address, as you said, not only the flu vaccine, but making sure that kids are caught up on the full spectrum of vaccines that they need to prevent any other potential outbreak illness.
Básicamente repitiendo el tema de que el régimen de vacunas de los niños se tiene que cumplir y asegurar que los padres estén haciendo eso, incluyendo el flu.
Thank you. Caroline, there was a question throughout the chat boxes regarding the rationale for capacity versus sites when it came to the relief fund. Can you talk a little bit about why we're looking at sites and not and how capacity is going to be part of that equation?
La pregunta es cómo vamos a asegurarnos de que no solamente las decisiones sean acerca de las decisiones de la repartición de los fondos no sean no solamente sean en relación al lugar, pero también la capacidad, la cantidad de niños.
Sure. So I noticed that Joanne has also been unmuted. So I will give a brief answer, Joanne, and if I fumble on this, please feel free to pick the ball up. But Bibi, I didn't know if you needed to translate. Okay, so the calculation for the grant will be based on the license capacity as well as the enrollment amount of students that are enrolled. Yeah, we did have a lot of...
Se va a tomar en cuenta la capacidad de la licencia, la capacidad de acuerdo a su licencia y después la capacidad de acuerdo a los reglamentos relacionados a COVID.
Okay.
Yeah.
All right. And so an extension of that question with the relief fund, if a program was in operation during the pandemic period or basically essential personnel childcare, do they still qualify for this relief fund?
Si yo abrí para y provee servicios a los niños de los trabajadores esenciales, ¿puedo solicitar para este fondo, Joanne?
Yes,
yes,
they will.
Thank you.
Thank you, Joanne. That's easy. Sí, puede.
So we will be issuing e-blasts tomorrow, as Caroline said earlier, regarding orientations on the relief fund. Maryland Women's Business Center and Nonprofit Montgomery will be offering it in various languages. They'll be approximately 1 hour each. We're going to be offering over the fast and furious over the next week and including Saturday. And they will also be recorded so you can refer back to it. As we get closer to the application period, the supports will extend not just to orientations, but also to technical assistance and one-on-one support, walking people through the application. Bibi?
Mañana vamos a avisarles por medio de este mismo tema de comunicación por el cual reciben la información de la oficina, por la oficina de Jennifer. ¿Cuándo se van a dar las orientaciones? Esperamos hacer orientaciones hasta que se abra la solicitud y después que se abran las solicitudes vamos a poder proveer asistencia técnica a los que necesiten ayuda en completar las solicitudes.
There's a couple questions in the chat regarding licensing, the Office of Childcare and Licensing. I'm hesitant, of course, to answer anything, but there's one that I can do. The question was related to
sobre el tema de la licencia. Yo no puedo contestar a todas, pero creo que hay una a la cual sí puedo responder.
The question relates to, do parents who are returning need to fill out all their forms again? As I understand it with MSDE, you simply as a program owner or provider need to fill out the reopening verification form. And of course, if you have new children, they are required to have documents, but your standing children do not.
Entonces, los niños que están regresando a su centro, usted tiene que simplemente llenar la verificación de reapertura. No necesitan llenar nuevos documentos esas familias. Una familia nueva a su programa sí tiene que completar todos los documentos necesarios.
Dr. Gales, a comment, many people had submitted through the registration a common question, which was struggling with the decision to reopen in the current situation. What are some things that a child care program, regardless if it's home or a center-based program, what are some things they should consider in terms of keeping children and staff healthy and safe?
Muchos estamos en un momento de decisión de que si deberíamos abrir o no abrir nuestro centro. ¿Cuáles son sus recomendaciones sobre todo lo que debe hacer un centro, un hogar para prepararse para los niños en términos del tema de salud y de limpieza?
I think first and foremost is you have to assess your capacity in terms of being able to screen children and screen staff to make sure that they're healthy, and to be able to execute the strategies that we put into place to keep people safe. So wearing face coverings and making sure that you have enough space to keep children as well as staff separate, and also the ability to make sure that you can clean surfaces and clean all of your equipment frequently to keep folks safe.
Debe poder realmente evaluar su habilidad de cumplir con todos los reglamentos, especialmente en relación a poder tomar temperatura de los niños, saber el estado de salud de su personal. Debe ver si tiene la capacidad o la habilidad de hacer el tipo de limpieza que se requiere para mantener a los niños seguros y mantener su centro o su hogar limpio.
Okay, one last question. Sorry, I just lost. Okay, I think in terms of the ratios, there was a question that was sent on the chat. Now I can't find it, but I know it was also asked during the registration processes. Does the 15 capacity or limit for group size, is that for all programs or age groups? No, it is only for 3s and 4s.
El tema del tamaño del grupo, el nuevo tamaño del grupo, como sabemos que MSD ha aprobado, son 15, y eso es para los niños de 3 y 4 años. Así que 15 es el número total del grupo, incluyendo los adultos.
And Caroline, this has popped up a couple times. Is the relief fund also for programs that serve school-age children only?
No. Short answer.
Okay.
Bueno, la respuesta es no.
But if it's a program that serves school age in addition to birth to 5, they can apply?
Yes.
Sí.
Okay. All right, so hold on. Let me scroll a little bit more here. I apologize. All right. I see that Rosana Soto from MSD Region 5 is on. Netta, do you think you can unmute Rosana Soto? Okay, Rosanna, let me know when you can speak. Okay, is Rosanna on now? I was hoping I could ask her a few questions about licensing. Okay. So again, if you have questions about licensing, I would definitely ask that you continue to send them, and I will be compiling all the questions to send to Stephen Hicks so that they can respond, and then hopefully be able to send that out to you quickly, very quickly.
Cualquier pregunta que tengan acerca de MSD, por favor póngalas en el chat. Nosotros vamos a listar todas las preguntas y pasárselas a la oficina del Estado y tratar de responder en esperamos pronto cuando nos manden la respuesta a ellos. Seguramente en una de nuestras sesiones de los lunes podemos responder alguna de esas preguntas.
Okay, so I'd like to thank our presenters this evening for sharing with us this important information and to inform us as well.
Quiero agradecerles a todos los panelistas por la información que nos han proveído.
As a reminder, the recording will be on our county's YouTube channel, most likely tomorrow.
Y vamos a tener ¿cómo se llama? El recording de esto en el YouTube channel del condado.
And if you have any additional questions, you can send them to our email, earlychildhoodservices@montgomerycountymd.gov.
Pueden mandar a esa dirección todas sus preguntas.
All right. Thank you very much, everyone. I appreciate everyone's evening. Have a very good rest of your week.
Gracias a todos y tengan una buena semana.